everybody. Thank you so much for tuning in to another episode of The Post with your host, myself, Jade Curtis. I'm here with Dr. Christina Madison. Can you tell us a little bit about yourself, Dr. Christina?
Yes, so I have been a clinical pharmacist for over 20 years. Majority of that time I've been working in public health, and I formed a consulting business called the Public Health Pharmacist, and I just recently launched the public relations arm of my business called Press and Presence because of the media that I've been doing. So I currently have a segment on Wired that has over 700,000 views, and I had 2 segments on Good Morning America.
Yes, ma'am. We love a good resume. That's amazing. So tell me about some of the things that you're passionate about your work.
So number one right now is really vaccinations and the attack, unfortunately, on preventative care and vaccinations. So one thing I did want to bring up is that we did get a win today from the Supreme Court, basically saying that we could have Obamacare provisions to allow for preventative care services to be continued to be covered by insurance at zero cost, which includes HIV prevention, which was one of the things that they were targeting, as well as routine recommended vaccinations.
Absolutely. And I love that you're doing a focus on HIV. I live in Atlanta, where a large percentage of Black women in Atlanta do have HIV or are living with HIV. So what are some of the advice or tips that you would give to women who are living with HIV or those who are looking to prevent it?
So that is such a great question because we just had a landmark medication that was just approved called lenacapavir for HIV prevention. It is an injectable medication that you only take 2 doses a year. Okay. It is going to be a game changer for HIV prevention, and I'm so excited to see what this does for the landscape of ending our HIV epidemic. The other thing too, when we think about Black women being at risk for HIV, part of it is because the marketing and advertising for HIV prevention and just medication, awareness and even HIV testing has been so targeted and focused at gay white male that we don't feel like women of color need to be tested. And one of the statistics that I found shocking was that the women who were diagnosed with HIV, it was one partner. So we're not talking women that are out there in the streets doing all the things and hanging out with a bunch of different people. It is literally one partner that is bringing it home to them.
Wow. And that's all it takes.
That's all it takes.
Wow.
Yeah.
Okay. And so I guess that leads me to wonder, especially with the stigma surrounding HIV, I guess, how can we ease some of the conversation or the intense conversation surrounding HIV, especially if it will increase more testing? So how can we kind of lighten up that conversation and make it as not as easy to talk about as STDs, but just in the same category as other STDs? You get tested for that, get tested for this as well.
Well, the one thing I would say is sexual health is overall health and wellness. And so when we think about why it's important for us to be tested, HIV care is not specialty care. It's everybody care. And especially when it comes to HIV prevention, because not only do we have oral medications, we have injectable medications. So there are so many different choices out there to help you to prevent yourself from getting HIV. It's just more about awareness. And then also the fact that HIV is not a death sentence anymore. There are people living very full lives and having a HIV positive status. So that's number one. And then also the fact that if you have an undetectable viral load, you have a 0 chance of spreading that to your partner sexually. That is something that we don't talk about enough. So the concept is called U equals U, which is undetectable equals untransmittable.
Wow.
So if I take my medications and I have an undetectable viral load, that means I have a 0 chance of giving it to my partner sexually.
Really? So that means you're still testing positive, but your viral load is
correct.
0. And so that's by staying on your medication.
Correct.
Really?
Yes.
I never knew that.
We don't talk about it enough, which is why the look on your face is why I talk about this all the time.
And I'm glad
the concept of U equals U is something that has been around since 2017. It was a big deal. It came out on HIV Black Testing Day in 2017, and we just don't talk about it enough. And I think that, we really need to get the word out that prevention, there's nothing wrong with prevention. I think it was Toni Braxton's sister that came out recently and said that she was on PrEP. So, it's not just, people that you would think, that are, potentially working in the adult film industry or maybe in the commercial sex work. It's anybody. Everybody can benefit from HIV prevention services.
Absolutely. And so I think one of the things that I really would like for us to touch on too is also the difference between HIV and HIV/AIDS. Because I noticed a lot of people use them interchangeably. Are they different? Are they the same?
They are
break that down.
Definitely two different things.
Okay.
So HIV is the virus, and AIDS, or acquired immunodeficiency syndrome, is the disease that can occur when the virus is left untreated. And that is when your immune cells get to a level that is below 200, and it puts you at risk for something called opportunistic infections. So infections that your body would normally fight off if you have a competent immune system. But because the HIV virus attacks our white blood cells or our immune cells, that's why that happens. And then it predisposes you to becoming infected with these infections that can cause you to be very sick, ill, and in potentially some instances die.
Absolutely. And so one of the things I do want to ask, and I know that this might be a heavy question, or maybe not even a question that you can answer, but why are Black women being so disproportionately impacted by HIV? Are we targeted? Is there someone after us? Like, why is that?
The biggest thing I think is lack of communication and lack of understanding of what your actual risk is. So I do think that there is a ton of information out there around HIV in the gay community and the LGBTQIA plus community, but we really don't talk enough around the risk for just heterosexual women, and then specifically heterosexual Black women. So the big thing that I want to tell you is it's not necessarily just us being Black, it's actually where we live. So your zip code is actually the number one risk factor.
Really?
So it's disproportionately based off of how much disease is in your area. So if we lived in rural Iowa, our risk would be much lower than if we lived in metro Atlanta, because the risk is based off of the amount of illness and infection in that area. So it's really just based off of epidemiology.
Well, awesome. Well, I do want to know, before we hop off, what is one thing that you really want people to take away from this live or from this interview?
The biggest thing is that everybody can get HIV prevention. Sexual health and wellness is not something that is taboo. Everyone should be able to enjoy a fun sex life. We just want you to do it safely. So if that means using a barrier method, if that means making sure you guys both get tested, because honestly, that is really the best first date you can ever get. And then also being on HIV prevention, because everybody can benefit from HIV prevention.
Absolutely. You know, I love what you just said. The best first date is getting tested.
Yes.
Okay, we're gonna make the clinic cute. That's what we're gonna call it. Make the clinic cute.
Make it cute. Yeah, and then we can get a DJ up in there too.
I love that. I love that. Well, thank you so much for joining me on this episode of The Pulse. We hope to have you back soon.
I would love that. Thank you so much.